Hello everyone. Today we'll talk something about arrhythmia. This part is very difficult for most students because they lack clinical practice. They haven't seen some patient ECG. I will take this lecture about arrhythmia. We have four sections. The first one is sinus arrhythmia. It's including four parts: sinus tachycardia, sinus bradycardia, sinus arrhythmia, and sick sinus syndrome. For the first part, sinus tachycardia. Sinus tachycardia means heart rate is exceeding 100 BPM in adults. For children, the yearly heart rate is higher than 100 beat. This is ECG. This is ECG. We see the person has a very rapid heart rate. What's the reason of sinus tachycardia? Usually, they have physiological reasons like exercise, movement, body movement, or strong emotion, or pain, or some stress. Body stress or such other things. For patients, they have two reasons. One is systemic reasons, another is heart disease. For systemic reasons, maybe fever, high body temperature, hemorrhage, the low body fluid, anemia, and infection, and hypoxia. For heart reasons, usually they have maybe the patient have heart failure, myocarditis, or acute malinfection. Some other factors, maybe they take some drug or take some food, hot tea or hot coffee. And some person they take alcohol, the heart rate will increase. For most patients with sinus tachycardia, they needn't any treatment. For physiological reason, they just become rest. The person have a rest. Maybe the heart rate is lower. For the systemic, they just treat the systemic disease. For heart reasons, they treat original heart disease. For some patients, they have very rapid sinus rate. They take some drugs, maybe two type. AAD, anti-arrhythmia drugs. The second part is sinus bradycardia. The patient, the ECG, we see the heart rate is very low. The person's heart rate is less than 60 beats per minute. We call the sinus bradycardia. For most of patients, if the patient have no symptoms, they needn't any drugs. They needn't any treat. If the patient has some severe symptoms, we will talk later. The patient maybe needs some pacemaker. Common cause of sinus cardia may be physiologic or pathologic. For the pathologic reasons, maybe the systemic disease or heart disease. The patient usually have hypothyroidism, obstructive diseases. They cause very pain. The patient feel pain, so the heart rate is lower than normal. Some drugs can cause the patient heart rate lower down. Let's see the third part. The sinus arrhythmia. Sinus arrhythmia is means. Let's see the ECG. The duration A and the duration B is between two QRS complex. Maybe the duration between two P waves. The duration A is very longer than the duration B. The variament is above 0.12 second. We call this kind of arrhythmia is sinus arrhythmia. For most patients with sinus arrhythmia, usually they are young person. They usually have some symptoms with palpitation, but this kind of patient may needn't any treatment. You just say it's normal for younger people. But the patient with sinus bradycardia, you will ask some, they have any other symptoms about sinus bradycardia. If the patient has the bradycardia symptom, you may treat as a bradycardia. A sixth sinus syndrome is the most important part of this sinus arrhythmia. You must remember and totally understand this part. For the sixth sinus syndrome, we also call them slow fast syndrome. The patient have two phases. One phase is we call the base phase. The patient has slow heart rate. Maybe sinus arrest, sinus bradycardia. Another phase is fast phase. The patient maybe have atrial tachycardia or atrial fibrillation. This patient maybe have severe symptoms. If the patient have very slow heart rate, the patient base phase is slow phase. The sinus bradycardia is the base phase. We usually treat them with pacemaking. Then they take drug to control the fast phase. But if the patient takes some drugs, the fast phase cannot be controlled. We can do some operation, maybe RFCA, do some cardiac ablation to treat the fast phase. Last week, I do such a patient. The patient have atrial flutter. Half years before, the patient have atrial flutter and totally AV block. Half years before, I plant a pacemaker into the patient. 6 months later, the last week, I take ablation for atrial flutter. The patient then get ready. For the basic slow phase, maybe have the sinus pulse, sinus arrest, or escape beat. Let's see the last graph, we see the long heart arrest, then escape beat from the AV nodal area. Because the QRS complex before the QRS complex, they have any P wave. The third line. This ECG, you can see a long, almost 3-second pulse arrest, totally heart arrest. We can see another sinus rate recovered. Then they come back to the fast phase. Bradycardia arrhythmia syndrome. They have lots of symptoms. The most severe symptom we must to get the history carefully. The most important point is syncope or nearly syncope. The patient may be drop down on the floor suddenly. Maybe they have consciousness, but they can't see anything. It means nearly syncope. It's a very severe symptom. This kind of patient, if ECG have proved they have bradycardia, this part of patient must be implanted pacemaker. And then some other symptoms like palpitation or shortness of breath, usually after body activity. So the patient body activity is limited. Maybe the patient have chronic heart failure. All these things, the patient have bradycardia, have this kind of symptom. They must be implanted pacemaker. Let's see what's his pacemaker. The pacemaker has two parts. The pacemaker here is a pace generator and leads. We see the pacemaker is two chamber. The upper lead is connected to the atrial muscle. The lower lead is connected to the ventricular muscle. So the pulse can go through the leads and stimulate the muscles. For treatment of sick sinus syndrome, we usually have to treat original disease, and also can take some drugs, usually atropine or isoproterenol. For some patients have some reasons to cause bradycardia, sick sinus syndrome. We usually implant a temporary pacemaking device. For several weeks or for several days, their rhythm come back normal. For the patient have long-term bradycardia, we take permanent pacing device. Thank you.